We are here today with Dr. Dlewati. He just gave us a presentation today that we are going to put up on the website for the club members and for anybody that is going to participate from this meeting and get all this good information that we have, because it's something that it's very rare. It's something that going through a journey of pulmonary fibrosis, I didn't. So I want everybody, and I want to invite everybody that is going to see this information to see the presentation that Dr. Dlewati did to us, and just to give us a little more insight about this disease or this test that, like I said, I have no clue going through this journey. Dr. Dlewati, thank you so much.
Thank you. Thank you. And the short and sweet is anyone with obstructive pulmonary disease who hasn't been tested for alpha-1 antitrypsin deficiency, testing is widely available and is something to look into getting.
Good. Now, how important it's for the community to know about this, to be informed about this alpha 1?
It's quite important. It's more common than we previously thought. People can have an abnormal gene and not be affected, but be a carrier, and it can affect their family members, be it their children, be it that you find out through testing this person that in fact they're unlocking this entire family of who is at risk and who in fact has the disease. So very important that we get testing done on a wider basis, especially when people are seeing a pulmonary physician, especially when someone has a lung disease. It's important in liver disease as well.
So, doctor, for the community that is suffering with COPD, pulmonary fibrosis, or any other pulmonary disease, what will be your recommendation to talk to the regular pulmonologist?
And my recommendation to anyone with COPD, with a refractory asthma, bronchiectasis, or something that hasn't been clearly diagnosed, there's just some abnormality, to talk to your doctor about being tested for alpha-1 antitrypsin deficiency, and to continue and participate in your care, ask questions, especially if there doesn't seem to have been a diagnosis progress. You know, what you offer, what you ask and participate in can be very meaningful to what we can do for you.
You mentioned, doctor, you mentioned the participation on these type of meetings and things like that, and continue doing the pulmonary rehab, and continue just all this process that we go through with pulmonary rehab, going through the disease. So how important is for all the community coming from you to know how important it's this doing the pulmonary fibrosis for the COPD patients, for the interstitial lung disease patients, how important is to participate from all these meetings, from the group supports, and get the insight from all this information.
I think the word rehab can trigger a reflex of I'm going to be put on a treadmill and someone's going to tell me move at this rate, and so. But there's much more to pulmonary and cardiopulmonary rehab that I think is not so intuitive and is so important to it. You mentioned education and what you learn. Some things that I'm only able to touch on during a short visit in the clinic of how to breathe if you're getting short of breath. So pursed lip breathing. Yeah, right. I can give a couple of minutes to that, but if you go to pulmonary rehab and the education and one-on-one with a respiratory therapist, how much attention you get to that and more expertise than even the physician can offer sometimes is essential. And people subjectively report great results from going to pulmonary rehab. And as I tell people who are hesitant, go try it out. There's no commitment. If after 2-3 times you haven't found any benefit, it's nothing I'm going to do to you for choosing not to continue. But I try to just get them through the door.
It is. And it's very important for people to hear that from a doctor, because for my experience, I can tell them that ever since I was diagnosed with a pulmonary fibrosis, one of the first recommendations was go to do your pulmonary rehab. You need to keep these lungs and maintain these lungs through our pulmonary rehab. So all the patients that are seeing this and looking into this, yes, like doctor just told us, pulmonary rehab is more than just going to do a regular exercise. It's a one-on-one with patient and pulmonary technicians. So by all means, thank you so much, doctor.
You're very welcome.
Thank you so much for being
It's
with
my
us.
pleasure.
We look forward to see you again
Hopefully,
with another
yes,
topic.
yeah.
Okay. And thank you everybody that is looking at these presentations and participate with us throughout the YouTube community or Facebook community. By all means, get involved, get well, look for help. Thank you.
Thank you.